A very good evening to everyone. Today we'd like to discuss about case study 4, Lim Shuqi. Next. Background. Jane, 55 years old, a mother of 4, recently diagnosed with stage 2 colon cancer. 3 months prior to the diagnosis, Jane reported weight loss along with loss of appetite and dysphagia. Physical signs such as dry mucous membrane of mouth have likely exacerbated her dysphagia. The next 3 weeks, she will undergo partial colectomy, followed by 12 cycles of FOLFOX chemotherapy. Initial weight is 56 kg, current weight 51 kg, height 158 cm, hemoglobin 11.6 gram per dl, and albumin 4.3 gram per dl. Next. The clinical sign of malnutrition noted in Jane is dry mucous, dysphagia, loss of appetite, and weight loss. Next.
So I'm Nuri Shahira. So the potential effect of cancer and its treatment on nutritional status. First, there are and dehydrations due to colon are not resume normal functioning. Hence, patients should increase intake of water. Second is fatigue, which is it can happen during and after treatment. Third is unintentional weight loss due to the loss of appetite. So patients should take a small meal, like 5 to 6 small meals per day to make it easier to get all nutrition and digest. 4. Eat mouth sore, which is it difficult to eat and swallow, so patient need to chew the food until it becomes mashed potato texture. 5 is cannot eat high fat food since it difficult to digest and may remain in stomach for a long time and can cause of increasing risk for painful. And lastly is increase in risk on infections due to a reduce of number of white blood cells cause of chemotherapy. Next.
So my name is Xingmei, and now I would like to discuss about the nutrition care process NCP for Jen with stage 2 colon cancer. So we will follow the ADIM process. The first step is nutrition assessment. For the anthropometrics assessments, we all know that the Jen has the normal body weight and the energy requirement for Jens is 1,275 kilocalorie. The percent of weight changes is 9%, as Jen lost 5 kg of weight or 9% of changes in 3 months. Losing 1 to 2 pounds a week is acceptable, and the weight loss in Jen still can manage as her BMI still in normal range, but she need to concern if further weight loss occurs. So for biochemical data, Jen has a low hemoglobin level with 11.6 grams per dl, and she has a normal albumin level with 4.3 grams per dl. For the clinical data, Jen has the medical history as she diagnosed with stage 2 colon cancer, and the clinical signs including malnutrition with dry mucous membrane of the mouth and dysphagia, which is difficulty swallowing, and the physical signs is unintentionally weight loss. This may also due to her loss of appetite. And for the dietary evaluations, according to the Jen's daily meal, we can know that she consumes coffee with added sugar and creamer every day, which is high sugar and caffeine drinks, and this may cause the worsen of colon cancer. Next, she consumes dry and solid food such as biscuit, white rice, roast chicken, beef with difficult to swallowing, and this may also cause her to loss of appetite. And the beef is red meat, which high in saturated fats, which is very difficult for digest. Moreover, she also having low nutrient diet, which low in macro and micronutrients, especially proteins, and this may also lead her for developing of malnutrition. And the energy intake of Jen is less than the daily requirement of 1,275 kilocalorie, and this may cause her to weight loss. And the water intake is not enough for her as she only drinks 2 glasses of water a day, and this may also cause her for dehydration. For the step 2 nutrition diagnosis, For the PES statement, the first domain in text is inadequate of nutrient intake related to lack of food planning, as evident by having a low nutrients diet. Second is domain in clinical, which is difficult swallowing of food and loss of appetite related to stage 2 colon cancer, as evident by dry mucous membranes of the mouth and dysphagia. For the next one is domain behavior, food and nutrition related knowledge deficit related to lack of value for behavior change as evidenced by high sugar and caffeine intake. So next.
So I am Nurul Nabila, and for the step 3 nutrition intervention, for the diagnosis 1 inadequate nutrient intake, Jane will follow her diet to include adequate calories and protein through the use of nutrient dense food to prevent further weight loss and eventually promote weight gain. And she will consume more fiber and protein food to assist in keeping the column clean as well as preventing infection from spreading. For diagnosis 2, difficult swallowing of the food and loss of appetite, Jen will follow instructions regarding diet consistency and swallowing technique provided by the speech pathologist. Jen's food intake will be developed into texture modification of food and fluid to easier her to consume. Next. For diagnosis 3, food and nutrition related knowledge deficit, patient will advise to reduce the sugar and caffeine intake that can affect her health. She can consume it only once per week or once every 2 weeks. She need to consume more water, at least 8 glasses per day, to avoid she from dehydrated. The patient will provide healthy food intake. Next. For step 4, nutrition in monitoring and evaluation, monitor patient understanding and compliance with plan and the positive or negative outcome. Monitor the diaphagia symptom and take action quickly if it getting worse to avoid effect of weight loss and loss of appetite. Patient will weigh herself daily and keep log. Report or appoint with doctor if the weight loss still continue. If nutrition status is not improving, such as Jane's weight record and goal not being met, Jane need to reassess and develop new goal and create plan for new intervention.
So again, me, I would like to continue my discussions. So as all we know, the Jane has a normal weight, normal body weight, and the energy requirement of Jane is 1,275 kilocalorie. And this is the calculations of macronutrients requirement of Jane. The estimate of protein requirement is 61 grams. For the carbohydrate requirement is 179 grams, and the fat requirement is 35 grams. And this is the food distribution table. And this is the meal plan prepared for Jane who has a stage 2 colon cancer before getting her surgery. These meal plans include the fruits with low fat, low sugar, high proteins, and high fiber contents. And the high fiber and high protein contents of food is very important to help to keep the colon clean as well as preventing infections from spreading. So we go for the breakfast. We have prepared the hot low-fat milks and banana for Jane, as the low-fat milk is low in fat, and the banana is a fruit that high in fiber and also rich in potassium. The potassium can help to replenish the electrolytes through the loss of their hair. For the next one is the morning snacks. We have prepared the wholemeal breads, canned baked beans, and boiled carrots. For the wholemeal bread, it is high in fiber content as compared to the normal white bread, and it is also a source of energy. And for canned baked bean, it is one of the legumes that is high in proteins and also high in folate, which can help to increase the produce of hemoglobin as Jane has the low hemoglobin level. And for the boiled carrots, the carrots is high in vitamin A, which can help body to absorb more iron and increase the hemoglobin level of gens. For the lunch, we have prepared white rice, spinach soup, grilled chickens, and baked ikan kembung. White rice is added as the main energy source and content of high carbohydrates, and the spinach soup is a vegetable that is high in iron, which can help the body to produce the red blood cells. And we accompany the white rice with the spinach soup. This is because it is more easily for Jen to be eaten because she has facing the difficult of swallowing. And the grilled chicken and baked ikan kembung is high in protein content. For the next is evening snack. We have prepared the fruits of orange and mashed potato. The orange is rich in mineral and fiber, as the high vitamin C can help to maximize the iron absorption, and the mashed potato is high in fiber and easily to digest, which is very suitable for gens as it facing the difficulty of swallowing. For the next is dinner, we have prepared bihun soup, baked salmon, and steamed broccoli. Again, cause gens has facing the dysphagia, so the bihun soup is more easily for her to be consumed, and it is also a source of energy. And for the baked salmon, it is high in protein content, and the steamed broccoli is high in iron also, which can help to increase the hemoglobin level of Jen. And for the supper, we have provide the Greek yogurt and avocado. The Greek yogurt is low in fat or no fat, and it is packed with the probiotic, which can help to combat the colon cancer, and it also can help in hydration. And the avocado is also high in folate, which can help to increase the produce of hemoglobin, and it is also rich in proteins and fiber. And this meal plan is suitable for gens before her surgery. So next.
For the last part, my name is Nur Syafiqah Shamira binti Jasmi, matric number S47792. I'll be explaining about the dietary strategies for the cancer patient who had loss of appetite, weight loss, and dysphagia. So the patient who had lost appetite need to eat in small amount but frequently. Next, they have to eat food that have nutrient dense, and then they need to avoid having too much liquid in between meals to prevent they will feel full in early. Next is next is the liquid are more tolerable than the solid for the patient. They need to consume nutritionally adequate but in high calorie liquids. For those who had weight loss, they need to eat smaller portion but frequently also, and then they need to have high protein and also high calorie food and snacks. For dysphagia, the patient need to choose soft, moist or blended food that are easy to chew, such as potato mash. And then they need to be in right posture while eating. So they need to sit up straight when drinking or eating. Also, they need to drink with straw, and they need to add sauce or liquid when they are eating to help them to swallow easily. I think that's all from my group. Thank you.